Welcome to Webinar Wednesdays with SMP. We're really happy to have you all here with us this morning as we talk about open enrollment, fraud, and scams. My name is Sunny Lawless, and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'll be your host this morning. Presenting for us today will be Nathan Coughlin, who is our Georgia team lead and community outreach specialist, and Jeanette Ringo, who is one of our Mississippi community outreach specialists. And as I mentioned, today for the September installment of Webinar Wednesdays with SMP, we're going to talk about open enrollment, fraud, and scams. During the presentation, you're welcome to type in any questions you might have into the chat, but we are going to hold those until the end of the presentation when we open things up for Q&A. There will also be a prize drawing at the end of the presentation today. You had to have been registered by 10:15 a.m. this morning, and you must be present to win. Now, before we get started with today's presentation, we do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. If this is your first time joining us today, we want to give you a little information about the Senior Medicare Patrol Program. SMPs are grant-funded projects of the U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviceWell. And our mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. So before we dive into the types of fraud and scams that can occur during the open enrollment period, we just kind of want to go over some very important dates. Each year, it's important to review your Medicare health and drug coverage and make changes if your plan no longer meets your needs, or to see if you could lower your out-of-pocket costs. The time to do this is during Medicare Open Enrollment. This chart with some information taken from the Medicare and You book at medicare.gov shows you some key dates that you need to remember. During the month of October, it's a great idea to start comparing your current coverage with other options that might be available. You might be able to save money or get extra benefits. You could visit medicare.gov/plan compare for help doing this, or you can contact your local SHIP, which we'll share information on later during the presentation. From October 15th through December 7th, you can change your Medicare health or drug coverage for 2026 if you want to. You can join, switch, or leave a Medicare Advantage plan or a Medicare drug plan during this open enrollment period each year. On January 1st, your new coverage begins if you made a change. If you kept your existing coverage and your plan's cost or benefits changed, those changes will also start on January 1st. From January 1st through March 31st, if you are in a Medicare Advantage plan, you can change to a different Medicare Advantage plan, or you can switch to Original Medicare once during this time. Any changes you make will be effective the first of the month after your plan gets the request. You want to remember that Medicare Advantage plans change each year, so it is important to make sure that that plan is still right for you. During open enrollment, you can stay in Original Medicare or join a Medicare Advantage plan. And if you're already in a Medicare Advantage plan during open enrollment, you can also switch back to Original Medicare if you choose to. And all of this information is found in the Medicare and You book. Now, before I turn things over to Nathan, we do have a quick polling question for you. And today's question is have you ever received phone calls from companies trying to sell you a Medicare health plan? So we're going to go ahead and launch the poll. And have you ever received phone calls from companies trying to sell you a Medicare health plan? So I'll give everyone just a few moments. This is a yes or no question. We'll give everyone just a few seconds and then we'll share the results. All right, about 5 more seconds to lock in those answers. All right, we're going to go ahead and close the poll and share the results. So I'm not surprised by these results, really. There's a lot of marketing materials and things out there happening about Medicare, especially during this time. So it looks like 76% of you said yes, and 24% of you said no. So I'm going to go ahead and turn things over to Nathan, and he's going to talk about why these types of calls tend to increase during this time of year. Nathan?
Good morning, everyone. As Sunny said, my name is Nathan Coughlin. I am the Georgia team lead and outreach specialist based in the Atlanta area. So let's talk a little bit more about open enrollment. Now that we have an understanding of the basics for this year's open enrollment period, let's talk about how unethical individuals may try to defraud beneficiaries during this period. During open enrollment, you may see advertisements on TV or the internet, or even receive phone calls from individuals trying to get you to switch your Medicare plan. It's important to do your research and choose the best plan for your own individual needs. These TV commercials, they're not necessarily scams. You see them all the time. They'll have some celebrity from yesteryear on there, Joe Namath, Jimmy J.J. Walker. And even if it's not a scam, it's on TV, the devil can be in the details, as they say. Medicare enrollment can feel complicated and confusing. Unethical salespeople may use that to their advantage to enroll you in a plan that is not right for you. Remember that Medicare plans are not a one-size-fits-all approach, and what may be the best plan for others may not be the best plan for you. Next slide, please. As open enrollment approaches, we here at Senior Medicare Patrol see a significant increase in scams targeting Medicare beneficiaries. Let's talk about some illicit activities by marketers or scammers that you should be aware of. First of all, I know we all deal with these in one way or the other. Phone calls claiming to be from Medicare or the federal government asking you to verify or update your Medicare number. An agent using misleading or high-pressure sales tactics to get you to enroll in their plan. Someone offering you cash or gifts in exchange for switching your plan. Representatives that come to your door uninvited or call you if you're not already a member of that plan. This happens a lot door to door. If you live in a senior community where a lot of seniors live, maybe a community exclusively for seniors, be very wary of anyone coming to your door trying to sell you or just have you switch your plan. Someone trying to charge you a fee for enrolling you in a plan. Emails or solicitations in the mail from companies offering Medicare plans. Now we're going to talk about some ways we can protect ourselves from fraud during open enrollment. There are several ways you can do this. First and foremost, one of the tried and true strategies of stopping scams of all kinds, hang up the phone. If you receive a phone call from someone claiming to be from Medicare or Social Security especially, other times these callers will claim to be from something along the lines of senior benefits. Either way, do not give them your Medicare or Social Security number. In the wrong hands, that Medicare number can be just as valuable to a thief as a credit card number. Do not engage with door-to-door salesmen. This tactic can be particularly prevalent if you live in a seniors-only community, as I said before. This is not an authorized way to sell Medicare plans. Be wary of calling phone numbers you may see on advertisements, such as those you see on TV or advertisements you receive in the mail. and even be tricky with these mail advertisements. I dealt with a gentleman last year. He received something in the mail, and it was on a hard stock cardboard. It had an American eagle on it, and it kind of looked like an official government document. This man, his English was not his first language, so he was struggling to know what that piece of mail meant. He showed it to me, and even I had to give it a good look to see what it was, if it was from the government or not. But if you flipped it around in very small print on the back, it had a disclaimer saying, this piece of mail is not endorsed or affiliated with Medicare or the US government. So that might not have been illegal, but it certainly was unethical and misleading. Just be very careful. Any of these things on TV also not illegal, but they may not have your best interest in mind as far as that plan being appropriate for you. And always get help from a trusted source. You can protect yourself from open enrollment fraud by doing that. We'll talk more about a trusted source on the next slide. We suggest two methods to find unbiased advice from which Medicare plan is best. And I'm not here to say every broker you encounter is unethical or a crook. There are a lot of Medicare brokers that are ethical and doing the right thing, but it's hard to know who's ethical and who's not, and who's doing the right thing and who's not. But we do have two ways to ensure you're getting the best advice to make good healthcare and healthcare plan decisions. The first one is using the Medicare Plan Finder on Medicare.gov. Please make sure you're on the official Medicare.gov website and not a website pretending to be the Medicare.gov website. We have to be careful about that. If you're like me, one of the first things you do sometimes when you want to go to a website is you go to Google. And a lot of times when you Google something such as Medicare or the cable company or a bank, some of the top results you see are not actually the results from your bank or Medicare. So if you're going to make decisions like that, especially with Medicare, making sure you're on Medicare.gov. Or for those who think they may need more assistance, maybe you're not super tech savvy and you don't feel comfortable getting on the internet yourself, we have a sister program called SHIP, S-H-I-P, State Health Insurance Assistance Program. These programs are also nonprofits funded in part through the government grants. SHIP programs are designed to provide Medicare counseling to discover which plan best fits your personal needs. These counselors do not work on commission and help seniors make informed decisions by providing free and unbiased guidance via telephone or face-to-face interactive sessions. The SHIP woman I mostly work with here in Georgia, she always says, you might have an agent or a broker you work with. She doesn't mind. Go to her for a second opinion. And if you still decide on that particular plan, because she doesn't get a commission, she says, go back to your broker or agent, sign up with them. There's nothing wrong with getting the second opinion when it's something as important as your healthcare. Next slide. So how do you go about contacting your state SHIP program? Every state plus Puerto Rico, Guam, and the U.S. Virgin Islands have a SHIP program to help seniors get unbiased assistance in making their Medicare selections. However, the contact number and organization that runs the SHIP program varies for each state or territory. For the states we serve in Georgia, Louisiana, Mississippi, and Vermont, the contact numbers on your screen as follows. Georgia SHIP can be reached by calling 866-552-4464. The Louisiana SHIP can be reached by calling the Louisiana Department of Insurance at 1-800-259-5300. The Mississippi SHIP can be reached by calling the Mississippi Department of Human Services at 844-822-4622. And the Vermont SHIP can be reached by calling 800-642-5119. If you know someone who needs assistance in another state or U.S. territory, you can utilize SHIP's official national website at SHIPHelp, that's SHIPHelp.org, and click on Find Medicare Help button at the top right corner of that state or territory's SHIP contact number. So I hope you learned a thing or two about open enrollment fraud and ways we can protect ourselves from that fraud today. I am going to pass things over to Jeanette to review the SMP 3 keys in success to preventing fraud, errors, and abuse in Medicare. Jeanette?
Good morning. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at a doctor's visit or pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask for your Medicare number for any reason. Keep records of all your medical visits and procedures that take place and any medical equipment that you've ordered. Next slide, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notice. They're also known as MSNs or explanation of benefits, EOBs. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: medical appointments you did not attend or were double billed for, medical equipment such as braces, catheters, or diabetic supplies you did not order or receive. Next slide, please. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have a question about your Medicare statement, call your health care plan, provider, or plan. If you aren't comfortable calling your provider or you aren't satisfied with their response, call SMP at our 877 hotline number shown on your screen. Next slide, please. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basic of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations or attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for SMP program is extremely flexible and is done on an as-needed basis. They determine how often they would like to participate. If you're thinking volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We can send you a volunteer information packet and answer any questions you might have about the process. Next slide, please. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platforms, including Florida, Georgia, Louisiana, Mississippi, and Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages especially are a great resource for older adults and their care partners to find out about how hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next slide, please. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or to ask us questions about potential fraud. And even if it's to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself, and invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website at www.stopmedicarefraud.org for more information about the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab at the top part of the screen. Now I'm going to turn things back over to Sunny, and she's going to talk to you about next month's upcoming webinar. Thank you so much.
Thank you, Nathan and Jeanette, for that information on open enrollment fraud and scams. As Jeanette mentioned, next month, coming up for Webinar Wednesdays in October, we will be discussing home health and hospice fraud and scams. That webinar is scheduled for Wednesday, October 29th at 10:30 Central Time. So just be on the lookout for the next invitation for that. And now it is time for our prize drawing. So everyone who was registered to attend today's webinar prior to 10:15 a.m. this morning, your name has been entered on our prize wheel, and the winner will receive a $25 Amazon e-gift card. So we're going to go ahead and give that wheel a spin, and you do have to be present to win. So let's give it a try. Here we go. Let's see, it looks like Miss Joy Peterson, you're our winner this month. Congratulations, Miss Joy. I will be reaching out to you to make sure that we have the correct email address so we can send you that prize. So congratulations. All right, so let's get us back over to our slides. Here we go. All right. So before we wrap up today's presentation, we did want to open it up to question and answers. So does anyone have a question? If you have a question about today's topic or the SMP presentation, you can raise your hand. As you can see on the slide on the screen, you should see a little hand button. You can raise it. We will unmute your line and you can ask.
And the good thing about our program is if you don't feel comfortable asking in front of the whole crowd today, utilize the 877 hotline number we gave you to give us a call to talk one-on-one. Always an option.
Absolutely. Thank you, Nathan. And we will also be sending a thank you email once we wrap up today. So, you know, that email is going to come from me. So if you have any questions or you think of anything that you'd like to ask after we end the webinar today, feel free to reach out to me directly. All right. Well, I'm not seeing any questions coming through. None through the chat or hands raised. So this will conclude our presentation today on open enrollment fraud and scams. Thank you, Nathan and Jeanette, for providing that information for us. And we appreciate you all joining us this month for Webinar Wednesdays, and we hope to see you all again next time. Take care, everyone.